produces telecare software solutions and is preparing to launch its patented flagship product, Daily Companion, a suite of applications and services designed to improve customer health to institutions such as hospitals, insurers, home care agencies, American Association of Retired Persons, and the VA, among others. Daily Companion's consumer version unites a suite of healthcare applications with an advanced medical alert platform to improve the health and safety of its customers while providing immediate, critical patient information to help paramedics and emergency room physicians save lives. This is really a breakthrough product, and they've really got something great going on here. We're going to have Tom Conway, the inventor and founder of MedSign, is not here because he's in Beverly Hills receiving an award for the Patrick Soon-Shiong Healthcare Innovation Award on behalf of this company, MedSign. Tom, just by the way, is a visionary with an impressive military career. He was doing classified work for the CIA, works in the movie industry, has a SAG card, uses technical skills for movies. This is a very skilled management team, and we have here with us Philip Marudo, the CFO and the chairman.
Thank you, Alan. Before you have to listen to me, I want to show you something. This is my partner, Tom Conway, introduced this, and you'll see him.
The sound of someone we know may be happening in the process. For me, it was my 87-year-old dad, and I wasn't there, and we weren't prepared. Paramedics often arrive in a blind, finding the person lying unconscious. They search for information about the medical history. More often than not, they don't find any, or if they do, it's out of date. They scramble to find what medications they're taking, and they're not always in the medicine cabinet, or by the bed, or even the fridge. And worst of all, you don't even know it's happening. I know firsthand. My dad was in the hospital for 2 days without even knowing about it. Luckily enough, he survived the ordeal. But I swore to myself that I would never let this happen again. Me, my family, or my friends. So as an engineer, I searched the market for products that would help save my dad, provide the information that could save his life, and let me know that the emergency had occurred. And guess what? The technology hasn't changed in 50 years. I realized if I wanted to make my dad feel safe and secure, and give me a little bit of peace of mind, I needed to do something about it. And that's what I did. I created Daily Companion. Daily Companion is a complete reinvention of what an emergency response system should be. Working with medical professionals, I developed and patented a home base station that communicates using a standard telephone line. The base station has a touchscreen that provides access to really important healthcare applications. With the touch of a button, or a wireless transmitter, your loved one is connected to our International Academy of Emergency Dispatch Trained Assistants, who will help them with their emergency. You know, paramedics' greatest fear is giving a medication to save a person's life without knowing what medication is inside their body. We eliminate that with Daily Companion. With the touch of the screen, paramedics gain instant access to your loved one's medical information, including their personal contact information, medical history, allergies and reactions, and most important of all, the medications they're taking. Do you know why there's so many unnecessary visits to the hospital and the emergency room by seniors? It's simply because they don't take their medication. So we created a reminder app. Reminders is a calendar-based program that displays and speaks to your loved ones to remind them to take the medication, drink some water, or even walk the dog. We have included a new product we call Today. Today is a daily set of brain exercising programs such as New Word of the Day, This Day in History, Trivia, my dad's favorite, lottery numbers. We've also included a speakerphone system with touchscreen access to the phone book, which has their primary doctor as their first entry, followed by their loved ones, all without holding the phone. You know, in my research, we held focus group meetings on the east and west coast of the country. We wanted to understand what seniors didn't want to. They understood the value of 911, but there's times when they didn't want to call it. They wanted a professional service, so we added Nurse on Call. With the touch of the screen, your mom or dad has immediate access to more than 2,000 registered nurses any time of the day or night. And if you have to go to the hospital, paramedics can take your health profile with them using our portable memory stick. Medical information travels with you wherever you go. No longer do you have to worry about hunting down medical information or prescriptions. Now it's all in one place with Daily Companion. Today's seniors want to be mobile. So to complement our home base station, we created the Daily Companion smartphone apps. Like the base station, you simply touch the icon to gain access to a suite of daily companion services, which include our call center, your health profile, the update feature for changes to your profile, and Nurse on Call to answer any medical questions you may have. We even provide pop-up reminders throughout the day, all designed to keep you healthy on time. And for those of you who don't have a smartphone, Daily Companion even works on a flip phone, BlackBerry, or other phones to provide you our emergency care service. When paramedics arrive, we scan your QR label to gain instant access to your critical healthcare record. With Daily Companion's home base station, smartphone apps, flip phone services, you now have the protection you need, anytime, anywhere. Daily Companion, designed to promote and protect your health.
Okay, so am I on here? Yes, I am. I can hear the feedback. So this is our core application. This is the system that the company was founded on. It's the I've fallen and can't get up kind of thing we all know about from TV, but it's that service on steroids, because we're providing all of the things that none of the other competitors in this PERS industry provide, and that's access to the critical health information. I'm not going to walk you through a lot of slides here because we have a limited amount of time, and I don't want to lose anybody's attention. This is the most important thing I want to show you. Our platform is not all about, our company is not all about personal emergency response services. That's a core application from which several others have emerged. We have created an enterprise software platform that stores, retrieves, and manipulates data. It's a very sophisticated proprietary software platform. From that base platform, we're able to support 6 different verticals. We have the consumer PERS that we talked about for personal emergency response. The second is the general market application for our mobile. Every family should have that mobile app on their phone. You should have your kids' information on there in the event, God forbid, of an emergency. Your information. It's not only for old people who are sitting at home. The third is the home care applications. Home caregiver companies have a lot of problems managing their caregivers in the home. They give them a daily care plan, then the caregiver goes from their home to the customer's home. Nobody knows. They don't know who went there, whether it was really their caregiver or not. They don't know whether the caregiver is really doing all the things that are in the daily care plan, and the variety of other issues that are involved. We have included, on top of our consumer product that you saw in the film, we've included management tools for caregiver companies to manage their caregivers in the client's home. The fourth vertical is the hospital ACO, hospital accountable care organizations. Hospitals have big problems today. Their big problem is in hospital early readmission issues. Obamacare imposes a tremendous burden, penalty if you will, on hospitals when they discharge a patient and that patient comes back in less than 30 days for the same ailment. So they are intent on creating tools, using tools and systems and processes to mitigate that early readmission issue. Well, what's the biggest problem? What's the biggest reason that people, and largely older people here, but what's the biggest reason that they do come back again into the hospital early? It's because they didn't take the medications that we were prescribed for. When you're discharged from the hospital, doctor does what? He gives you a new prescription. He says, take this, take it 3 times a day, do whatever. They go home, sometimes they don't even fill the prescription. They go home, don't take the medications. And so our system with its reminders, see the applications down at the bottom, these are the reminders, the personal health care, the nurse on call, and the 911 are all features that are supported for every one of these verticals through this common platform. So through our reminder system, hospitals are able to check up without having to have nurses call them every day, call every discharged patient every day for 30 days to make sure that they're taking their medications. Instead, they give them the application, and if they have a cell phone, we put the application on the cell phone. If they have a tablet, otherwise the hospital will give them a tablet. And they'll take that tablet home with them, and the doctors are going to tell them, we're going to remind you to take your medication. You're going to touch the button and acknowledge that you saw the reminder that you took your medication. It's infinitely less expensive and highly more efficient than a manual process here. And then, of course, we have the same issues for payers, for healthcare providers, not providers, healthcare insurance companies. Well, the Aetnas, the United Healthcares, the Kaiser Permanentes, all of these companies, I mean, their number one objective here, apart from caring for the patients, obviously, is to mitigate unnecessary claims. So they want to reduce claims as much as they can. So where are the heavy hitters in that? Well, it's in emergency room visits. They're a killer for insurance company payers. And for, again, for early readmission into hospitals. Once again, our program, in the hands of particularly what they call frequent flyers in the healthcare insurance issues. They put our processes in the hands of these frequent flyers, and they eliminate, or at least mitigate, the issues that create these excessive and unnecessary expenses. And finally, we're able to do some customizing here. It's not all canned, and we know what the application requirements are, we know where the needs are, the solutions, the problems that we need to solve for those other 5, but we have the ability to customize services. And right now, we've created a special customized service for AARP. AARP has they call it a real tablet. They have a tablet that's a proprietary tablet of their own. And they sell it, obviously, to their 38 million subscribers. But it doesn't do a whole lot, you know? It has a bunch of nice, cute little things, but it doesn't do critical things for them. So we've created, we showed them what we do. They said, can you put that on our tablet? So we've created a special application for them, so we would put all of our services on their tablet. Well, what's such a big deal? Well, I need to tell you that their tablet doesn't make telephone calls, okay? Tablets don't do that unless they have a cell phone service, and all of a sudden now you're involved in additional expense. So we created a technology that uses Wi-Fi and converts that Wi-Fi to a VoIP call, and that VoIP call comes out either to our call center, or comes out to the nurse on call, or comes out to whomever it was intended to go to. And we're in the process right now, we're in Washington last week, we're in the process right now of presenting this to AARP for their consideration. And of course, other large organizations like the VA and international. We're working with an international company. Unfortunately for them, they're in France right now, but they have a tremendous interest in our technology and marrying it with what they do there. So we're really a technology company doing advanced things far beyond what you saw in the film. Film is just it's the mother application. Everything that we lay on top of that is really geared to take us out of, not to exclude them, but take us over and above the one-off consumer business, which is huge. There's 40 million seniors out there right now, soon to be 80 million. You know, but to take and go beyond that and go into the institutional market, where we can do bulk pricing, if you will, instead of, you know, monthly fees and the like. So I'll leave it at that and open the floor to questions.
So let's start with, tell us about your technology and software. Is there anything proprietary here?
It's all proprietary. We've got 500,000 lines of code in that software, so it's 100% proprietary. We don't use any third-party software.
Anything, just trade secret? I mean, it's secret code? No, there's no patents or anything like that?
Well, yes, we have a patent actually, and the patent's a process and utility patent. It's not on the software in particular, but it's on the process and how we handle customers' data and manipulate that data and transfer it to the emergency responders. That patent was awarded, as a matter of fact, September 26th last year.
I guess where I'm leading with this is tell us a little bit about the competition. You know, what's to stop you from coming up with a great idea, and then somebody, you know, a big player is coming in and try to copy?
Well, there's nothing to stop it. I mean, the fact of the matter is that you can have patents, and you know, we all know what patents. Some people tell me trademarks are more important than patents, you know. And all of our deals are trademarked, you know, registered trademarks. But the The fact of the matter is that you can't duplicate this overnight. I spent 15 years, actually 25 years, in the technology business myself. This is not something you're going to do overnight. We hope that we attract the interest and the desire of larger organizations to come in and have our service, and it becomes a build or buy issue. And today, in the healthcare technology industry, where things are moving so fast, I mean, it's lightning speed, the changes that are happening in healthcare technology today. It's a focus of just about anybody who's looking for future business. We think that it would be a buy decision much more than a build decision. If they want to get into a build decision, we would be first to market at least 18 to 20 months ahead of anybody that wanted to do that. First to market is big.
Let's talk a little bit about the round.
Right.
Tell us what you're looking to raise, what terms, what are the terms?
All right, first let me point out that we've been a development company for over 3 years, almost 4 years. And all of this has been an extensive development. So it's proprietary software, 500,000 lines of code. All of that takes a lot of time to do. And we did it. We've got $4 million on our books in cash that we have raised in early rounds and stock that we've given out for services to various companies. Today, we are pre-revenue. We haven't put our product on the market yet. That's what I'm here for. We're looking for revenue partners to take us out to market. Now, as I pointed out, there are many legs to this platform and to this business. So we're not looking for a finance partner to go ahead and execute this entire business plan. It's too ambitious to do all at one time. And so what we want to do is we want to do it in steps. And how much money we raise would be somewhere between $500,000 and $2.5 million. And I say, that's a big span. What's that span all about? Well, it depends on how many of these legs and how much we want to put ourselves out into the marketplace. So from that smaller amount of money up until $2.5 million, we have use of funds plans for every one of those levels.
Any questions from the audience?
Yes, sir.
Sounds to me like you need a great call center.
Well, I chatted with you and your guys, and absolutely you are a great call center, and I wouldn't be a bit surprised if we didn't go ahead and have some things to do with each other. But on that subject, our call center is very specific. We're not making calls or doing sales calls like you do there. Our call center is only receiving calls from our customers who are looking for emergency services. That call center is highly trained specifically to deal with, and in particular, senior citizens who are calling in and needing 911 services and the like. And by the way, they take those calls up and down the West Coast for the California Highway Patrol and a variety of other people. Well, we will talk to you about
Yes, we should talk.
Amit, in the back, please.
How much is the product to the consumer, and if there's any monthly service fees?
Absolutely, and that's a good question. Thank you. The beauty of this business is that it's built on a recurring revenue base. Like all of the predecessors who are in the PERS, personal emergency response business, I've fallen and can't go to type of people, they're charging anywhere from $24 to $39 a month. So we're priced in between that, and actually we have got $24.95 pricing in here now as an introductory level. So we have a subscription for our monthly services. There's a fee for the device. It's a one-time charge. The device retails for $249. We're selling it for $99 now. One-time charge and $24.95 a month for the consumers. When we get into this levels of hospitals and insurance companies, they're not going to pay us $34 a month for their services. We want to cover 1 million clients with these people. We want to cover hundreds of thousands. The insurance companies, I know a lot about this ACO business, and the insurance companies are going to focus on that 15% of their beneficiaries who represent 80% of the claims. We call them frequent flyers. They're the people that are in the hospitals all the time. They're the people that are in the emergency rooms all the time. And they're going to take our services and they're going to put it in the hands of those people. Those people, for 15% of AARP, of the 38 million subscribers, are a lot of people. And they're not going to pay us $34 a month. So we go into a capitated pricing model with them. And we're talking to them about flat fee pricing on an annual basis. Could be $1 million a year, it could be $8 million a year, it doesn't matter. It depends on what the organization is, but it's a recurring fee and we would support them on that basis.
Philip, thank you so much.
No, thank you, appreciate it.
MedSign, thank you very
for
much.
your attention.